Good evening. Since Time Waits for No One began airing, it has always been our goal to educate the community about the local treasures that improve our community's health and quality of life. Tonight, we will explore such a treasure, the Sight Center of Northwest Ohio. If you or loved one loses vision due to an age-related condition, you might think your life is over. People often isolate themselves and don't believe that they can still maintain an active, independent lifestyle. Join us tonight for a guided tour of the Sight Center of Northwest Ohio, a center of hope. Good evening. Tonight we're going to discuss blindness and vision changes, which is we see it frequently in the elderly generation. And we are fortunate enough in this area in Northwest Ohio to have the Sight Center of Northwest Ohio, which is focused in their services about this kind of group of patients, really to help them to achieve a better outcome and a better quality of life. And it's my pleasure to welcome Dr. Goldie, who is going to talk to us about this aspect of the problem. Thank you for being here.
Well, thank you, Doctor. The Sight Center is a low vision facility that we can help people with sight loss of varying causes, but our main clientele, frankly, are folks with macular degeneration. And we have various means to enable them to retain their independence, to be able to read their mail or to try a new recipe, and to safely get around. We're concerned, of course, on individuals with impaired vision have over 8 times the likelihood of falling. We can't cure many things at this point in life, but it's coming. We're getting better and better at being able to assist people to do those things otherwise they couldn't by means of magnification, enhanced contrast, and other tips. For example, we would not want to have someone pouring hot coffee in a dark cup. Mm-hmm. We'd rather have the cup over the sink and be a white cup. That way, you can recognize when it reaches the level, and if it does spill, it doesn't scald them. We can teach proper manipulation with a white cane if the sight is totally gone, but we also have recommendations for various ways to maintain their use of a computer, for example, technology which is not glasses and not surgery, but we can enable them to send emails and receive emails, things of that kind.
That's great. So in that case, does the center focus on diagnosing some of these problems with the patient, and then after that try to deal with how the quality of life and how they can adapt with their visual
Dr.
impairment?
Ameer, we do not establish the diagnosis as such. Every patient that we see has been through everything surgically and medically that's available to deal with their problem. Okay. But once that has happened, we can come in and help them, in spite of those limitations, still function.
That's great. And based on that, I mean, if we will talk specifically, I mean, you mentioned the macular degeneration. Can you define the macular degeneration to the audience? I mean, exactly what do we mean by that definition?
It is a loss of detail, central vision. When you look right at a person's face or trying to read, it is the detail aspect. The big picture can still be very good to get around. The individual does not need a dog, but is very frustrated because before they could just go and get some new glasses and now they could read or drive. But when macular degeneration is advanced, you're no longer going to be able to drive, and so such tasks as brushing your teeth by putting toothpaste on the toothbrush is very difficult. We would teach them, for example, just brush your hands clean, put the toothpaste on your finger. You can feel the nozzle, then put the toothpaste in your mouth, then the brush, so you're still accomplishing what you want. What we would recommend different means to accomplish it.
So it's technically minor changes in the process which they are doing, achieving the same result of that skills which they are doing, but using it in a different way.
Yes. We have various magnifiers to view price tags, the label if you are concerned about trans fats, things of that kind when you're shopping, or to be able to see the aisle signs in a grocery store, and the expertise to avoid falling. These are the main things that we emphasize beyond just seeing better in
Good.
terms of
Good.
letters or television.
What could be the other causes of visual impairment or blindness toward that age group? I mean, if there's any other causes?
Oh, many, many. Diabetes is the next larger, most frequent problem. Diabetics think if they take their pill or their injection, now they can go ahead and eat everything they want. And of course that's not the case. But diabetes is a major cause. We see quite a few people with either one or both eyes impaired from diabetes. Glaucoma is a loss of the peripheral vision. They can often see straight ahead until the very end, and then that extinguishes. But we can help people with having had a stroke, for example. Sometimes they have either a sight loss of 1/2 of the vision by temporal hemianopsia. We have some devices that can assist with that, and many other problems of, where they can't be cured, yet we can help them go on and retain their independence.
What about the cataract, which is the most common, probably disease we hear about?
Long, long way. I've been in practice since 1965. In those days, you had at least 4 days in the hospital, and then you couldn't get glasses right away, and what glasses you got were tremendously thick. We do not see people with those nowadays. They go in and have the cataract in the morning, the cataract procedure, and they immediately start to see generally quite well with the implant, and they're home having lunch the same day.
That's great.
So mammoth improvement.
Now, talking about all of these diseases, I mean, I assume the problem is a gradual process toward the blindness. It's not something just comes on and turn your vision dark.
Certainly most are gradual onset. Sometimes you can have the loss of one eye from temporal arteritis, for example, can be devastating and non-reversible. Most eye problems of this kind are gradual onset. So certainly some other diseases such as retinitis pigmentosa, again it's a genetic defect, but we're working every which way. I'm a member of Lions Club, and we contribute extensively for eye research for medical schools here in Ohio. But some blindness is going to be here for quite a long time to come, but every year we see new developments and better ways to treat disease. For example, I just got a letter from Retina Vitreous that we're going to have an eye drop that can be put in along with medication to assist with wet form macular D. Now that's a lot better than getting a shot right in the eye.
Absolutely.
Yes.
And when we're talking about that gradual process of the disease, that brings us really that how can we prevent it, or how can we delay that end result, which is the blindness? I mean, I'm sure there is some measure, preventive measure, and we were talking before we start the show about some of those elements. Do you mind to tell us about some of those preventive measures, which is so important to address with the elderly?
Often when a son or daughter is here with a parent or grandparent with macular D, and I mentioned that this is about 70% inherited genetically. And of course that gets their eyebrows up and say, boy, I hope I don't get this. So indeed, we know that among the trigger factors, even though you have the gene, it may not be expressed. One of these things that can really assist, if you are a smoker, boy, you can do yourself a big favor in avoiding this thing if you quit smoking. There's lots of other good medical reasons not to smoke. We know that eating a sound diet, particularly in leafy vegetables, things like spinach and kale and other things that are rich in a nutrient that's called lutein. We used to have parents and grandmas always hammering it, Johnny, eat your carrots. Well, carrots are rich in beta-carotene, but even more important for the macula, if we can avoid exposure to ultraviolet through a lifetime, even teenagers, because the pupil of the eye of everyone at age 17 is about the largest it's going to be in your lifetime. So the damage from ultraviolet, cumulative, that's whole lifetime accumulation of subtle ultraviolet damage is irreversible. So by the time you're 65 or 70, you're stuck. But at least take precautions. If you love to be outdoors, fishing, golfing, whatever, wear some good sunglasses that block ultraviolet. They need not be extra dark, but wear them even in the wintertime. On an overcast day, you don't think about it. It's not warm. Many people associate sunglasses with summertime. But the snow, that's why the earlier explorers around 1900, they're looking for the North Pole. Some of them became snowblind, and that was from ultraviolet exposure. So that kind of thing, we can act as a preventive. But most of these other eye diseases are not microbes, so there's no chance to develop a vaccine. Monitor your diabetes. You should have an eye exam every year, even if you're seeing well and your sugar level's good. An annual eye exam if you're diabetic is just vital, because it's hard to play catch up in this. Once you have a hemorrhage in the eye, lots of damage done.
That's absolutely true. So based on what you are telling us, how can people reduce that exposure? And I see how important it is to have the minimum possible ultraviolet light, effect on the eyes. How can we reduce that? What's the best way to do that?
By wearing good lenses. Even clear lenses that are made of a material called polycarbonate block ultraviolet quite well. And of course, wearing a hat. Wearing something to block the overhead light, because at noon at summertime, light's directly overhead, and even good sunglasses leak. So if you put the brim on a hat, can go a long ways to prevent that ultraviolet exposure. So Dr. Ameer, this is more of the traditional, this is called an EDTRS chart. It was involved with the study on diabetic retinopathy a number of years ago, but it's basically a fixed chart. We typically test at 10 feet with both of the systems, but the advantage of the computerized method of testing is that there is no recall, especially if the vision's very poor and they can only see really large letters. One great big E, for example, on a traditional paper eye chart, then it's patient sometimes recalls what that is. Most eye charts have a big E at the top, but with this system we can easily switch when we try the other eye. Moreover, we can do some other tests that cannot be done, such as contrast sensitivity. For example, if I start to fade the contrast here at 75, 50% contrast, we get down to 10%, pretty soon a normal, healthy eye no longer can see the letters, but they are still there. For example, then, if I do the reverse contrast, make the background dark and the letters light, here now at 5.5%, you can still see them. So we've got devices that a blind person or nearly blind person can still see by virtue of the fact using reverse contrast.
The change in the test from a simple board to more technology, to the extent which is giving you a better diagnosis about the severity of the disease, you will be able to judge it more appropriately about what could be the best treatment for that individual.
Yes, and much quicker.
Much quicker. That's great. Going back to the current services which you provide, can you take us step by step about when a family member bring their parents or their loved one, to this center, how is the assessment start, and then how you decide about what kind of service that you're going to provide them?
Well, everyone here is referred. So many of them have already seen a retinal specialist or a neurologist sometimes after having had a stroke. So we do an intake interview first, and then we do a basic eye exam. Even if they only have one eye left, if I could improve that only 10%, by golly, we want that 10%, sure. Because what other aids we have work even better then. So we first establish if a little change in the glasses might be helpful, or establish what is the need, what does this person want to accomplish in their life that's giving them difficulty now. Trying to enable them to safely get around, avoiding falling. We deal with everyone that has visual problems all the way up to no vision at all. We have mobility experts can teach a blind person to manipulate with a white cane and be safe, and those sorts of services. Mobility, orientation, we can visit in their home, look for fall hazards, for example, and how to retain their independence. That's the #1 goal.
Sure. And what about, I mean, you are focusing only on the older generation, or
No,
you
no.
have some children or
We have
some young
children,
adults?
we can serve all ages. Oftentimes this very large exam room we're sitting in is because a child, we may have mom and dad, maybe one of their siblings or two, but we would have their own teacher and perhaps a special ed teacher or other individuals. Sometimes we have students from the medical school here as well. That's why we need more space than a typical exam room provides.
That's
so
great.
we're fortunate to have this
And
big
going
room.
back to the prevention point which we mentioned, other than the exposure, if there's any relationship between blindness, macular degeneration specifically, and eating habit? I mean...
Well, we know that this lutein, which is found in the dark green vegetables, you know, kale, I'm not a big fan of kale particularly, but spinach, but also what supplements are going to be probably the most effective as to improve their odds of retaining, even though we're not going to regain lost sight, but at least hang on to what you got.
Dr. Goldie, in the final stage of this discussion, I just want you to give us your advice, your recommendation to those individuals who has some visual impairment at this stage of their life, or their loved one who taking care of them. What do you recommend?
First of all, if you are diabetic, it is crucial to have an annual eye exam. A dilated exam which can observe the retinal vasculature, any threat, and deal with that promptly can save the sight, avoid blindness. Certainly trying to eat a balanced diet and protection from ultraviolet at whatever age in life you are, but especially, of course, teens. It's difficult to get teens to know that they're not going to live forever. But avoidance of ultraviolet from proper sunglasses and a hat can go a long ways to help preserve your vision for many, many years of life.
And for the individual, you mentioned that there's a good percentage of patients are genetic, you know, the macular degeneration basically. Do you recommend annual exam, or at least every few years exam for the family members who has immediate relative who has macular degeneration, like their mom or their dad?
Absolutely. So again, getting it, and particularly with supplements, oftentimes can have their vision prolonged much, much longer if they finally do get it. At least they've got many more years of good functional vision.
Great. Thank you. Thank you so much, really. We appreciate your service in the center, especially for the community of Northwest Ohio, who you're providing this service to everyone who need it. And I know with no doubt in my mind that everyone would like to thank you and thank the staff in the center, and we appreciate you being here.
Thank you, Doctor.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at toledocardiology.com. That's toledocardiology.com.
In the other part of the site center of Northwest Ohio, I meet here Stacy Butts, who is the executive director of the center and really the one who is taking care of this place, and we appreciate your service in this town.
Thank you.
Stacy, you have this shop started recently, and there was a reason for it. Do you mind to tell us why did you start the shop?
Absolutely. We started the shop because we felt there was a need for someone to be able to come in and get a magnifier or whatever device something they're struggling with. If they need a device, they can now walk in. This is set up in a simulated apartment, so they can actually walk around and they may think, oh, I just need a magnifier, but we'll show them how to mark their appliances and some other simple things that they can do for themselves as well. And because it's in an apartment setting, we can sit them down on the couch, you know, simulate the lighting in their home and show them the best way to use their magnifiers and give them a little training at the same time.
So it's making the center job, which is educational on top of whatever product you're going to give them, basically much easier.
Yes, it is. And it's really opened our door where we used to maybe say no, we couldn't just sell you a magnifier. They can now walk in and they can buy that magnifier if they want. And if they find that's a little too hard for them to pick, they can come through the clinic and we just help them through that process then.
So Dr. Goldie was talking to us about some of the modalities and magnifiers which you have here, guys. Do you mind to take us through a tour and tell us what do you have so the public, you know, can understand what they can come down here to buy?
Yes. Well, this is one line of magnifiers. We actually carry 3. This is our most popular. It's sort of our mid-range line, but it does come with a lifetime warranty, which is why people love them. But there are 2 kinds of each magnifier. There's a stand. If someone's going to do long-term reading, it actually sits itself on your paper, and you move it without having to lift it or hold it. And then handheld magnifiers. They're all lighted because the lighting is so important. A lot of people want a small thing to throw in their purse for when they just go out to read a menu. You know, that nice romantic lighting at the restaurant is not the greatest for trying to actually read the menu. Something that can go actually around your neck if you still want to sew or do something like that where you need both of your hands. You can actually just hold it around your neck, it's propped up, and then you can work underneath it. A dome magnifier. A lot of people who don't want to admit that they have a vision impairment but might struggle to read certain things will have this on their desk because it looks like a paperweight. We have some object locators, color identifiers. If you've lost all of your vision, you still want your clothes to match. So there are apps for that, but there's also that if someone doesn't maybe use a smartphone. Phones, large button phones. Some of them that have higher speakers, if you have a hearing impairment as well, but just the larger buttons, often they have Braille on them as well.
The purpose of this shop is not to make money as much as to help the clients and those patients who are coming here to get that help. And in reality, for sure, to support them with the product at the same time, the center will maintain its financial stability.
Yes, that is exactly what we're going for. And if something is a little too expensive for someone and they're willing to come through the clinic, there are grant funds available to help them get devices as well.
Okay.
Most of these things are not covered by insurance.
Sure.
So we have the assistance to get through what grants might be good for someone and to help them get the right magnifier, what they need.
That's great. That's great. So Dr. Goldie mentioned to us that basically that this is an educational program trying to educate the patients and those visually impaired how to live their daily life. Do you mind to take us step by step? What do you do? Like how do you teach them these kind of stuff?
Most of our services are actually in someone's home. So our service providers may come back here and get these items and take them to someone's home, but most people want to still do their bills on their own. And if you have no vision, it's hard to use a calculator. This one talks. So there's talking calculators. Signature Guide, a very simple, cheap product, but if you need to sign your name on the dotted line, you can pull that out of your wallet and know exactly where to sign and not worry about going up or down. Okay. Colored paper with really bold lines. It's easier for some people to see with the contrast. A check guide. This is a pretty big tool. Something's in here the wrong way, but everyone knows how to write a check. If you've lost your vision, you don't forget how to write your check. You just don't know where to put it on the piece of paper anymore. So you slide your check in, you close it, and you know what those spots are. Wow. So you can just handwrite it in there.
It's much easier.
It is. It's much, much easier. Large print address books, check registers, anything that you would need for your daily living, we seem to be able to find in a larger print or with just a little more space.
That's great. That's great.
If you come down here, we actually then move into our handheld CCTVs. So the idea is a closed circuit television. Someone needs a magnifier that gets up to, say, 7x. The visual space of that actually gets smaller. So we would move them to a handheld magnifier because each of these will go from 1x to 15x. Wow. So it will move with you. If you have a progressive eye disease, you can still continue to use this same product, and you can also do some of the contrast things as well. So you can have black on yellow or black and white or full color. And that can fit right in your purse, or you can carry it around with you wherever you're going to go.
What about these, I see these nice big monitors, what are they for?
Yes, the big monitors are our large desktop CCTVs. So if you like to do a lot more reading, you're obviously not going to put that in your purse, but if you like to read books or the newspaper, you can slide something under there and do a lot more long-term reading, something that's a lot larger, and you have all the same, you can magnify, you can change the contrast, and all of those things for whatever works for your eyes. And each of these, you can get up to 24-inch screen, which is really a lot more space. And once you get up to a 15x, you're not going to get much on there if you have a small screen.
What's the volume of patients or needy people who come to your center on an annual basis?
We serve about 650 people a year, and one person could come just through the clinic and get a magnifier and that's all they need. Another person may come in and really want a lot of cooking and cleaning or how to use a white cane. Their services could go on for a long time. It's many visits to their home to get them to a good place.
So technically 600 patients, but you are talking about multiple thousands of services for each individual probably, and
yes.
that keep you busy, no question.
Yes, and we serve 16 counties in Northwest Ohio, so it's a very large span, and with us doing most of those services in home, it's a lot of travel for our service providers as well.
That's great. Stacy, can you tell us about the funding for the center with that excellent service you mentioned and the thousands of services you provided? How you get your fund, how you get your support?
We do a lot of grant requests, private grant funds, along with state support through the Opportunities for Ohioans with Disabilities, and contributions. So anyone that would be interested in contributing and helping us out a little bit can go to our website, which is sitecentertoledo.org, and you can make a donation right there.
Great. We need that.
Yes,
I
definitely.
have no doubt that with the type of services they provided and the number of patients they suggested that they see every year, I'm sure any kind of donation is very helpful, and I hope our community, as I know them all the time, very generous and very supportive, and we wish the best of luck for you.
Thank you very much.
Thank you so much for having us.
Thanks for coming out.
What did we learn? We are not alone. There are resources and people waiting to help those with vision loss. With the proper help, those daily living activities that may be difficult now can become easier. Let's take every day and do the best we can for ourselves and our families, because time waits for no one.
Local doctors and experts keeping you educated on your health. Time waits for no one. Encore presentations Fridays at 1:30 on WTOL 11.